But I would like to go through some case studies of using my product, the Monmouth clear aligner system. So my first case study, this is Stephanie. Stephanie came to me. I was a third consult, right? So it's a third opinion. And she went to an orthodontist. Then she went to a general dentist, and then she came to me. And the first two consults that she had recommended to address her chief complaint, which was upper and lower spacing, pretty evident in the photo. And both of them suggested Invisalign. And the fees of between the orthodontist, the general dentist, there was a discrepancy there. It did go down when it went to the general dentist, but it was out of her budget. And she was coming to see me to see what I had suggestions with, maybe a bonding or any other alternative. And I said, no, well, bonding, I don't really think is great for you because you would have these big blocks of teeth. You don't really have much of a tooth size discrepancy, but I do have an alternative to Invisalign. And I mentioned Monmouth, and what is that? It's aligning your teeth with a great product. It's just that the price point that I'm charged for it is lower, so I'm able to offer it at a lower price. So if we go through our case, what we do on a first visit and on a consult is that I always take photos. Even if it doesn't seem like it's going to turn into anything, it takes me like 3 minutes. You could also address your staff or train them how to take these photos, because a photo, and John's going to talk about this a little bit later, and I mentioned it a little earlier, photos are an emotional connection. And when you take these and show it to them on the camera or put it up on a screen, it's like blowing up their concern. So not only do they have a concern, but now you're like, hello, right? It's like, let's take care of this now. So these are our intraoral and extraoral smile. And you can see that, her tooth size, it's okay. I mean, the centrals are a little slender, but we could close this pretty easily using Monmouth clear aligners, and really in a predictable way and super quick. So if we go on to the next slide, there she is. That's Stephanie. 4 months later, 0 refinements. This is a slam dunk case. I mean, if you see somebody that has just a little flaring and they're spacing and you haven't done clear aligners before, grab them, take a scan, take some photos, send it in. I mean, that's a slam dunk case. Again, 0 refinements. She was done. But the next photos, we'll have some more photos of her intraorally. You'll see on that slide. Chris, if you go forward 1. There you are. So that's a close-up and occlusion, great midline. You could see that the 8 and 9 looked like there were maybe a little bit of a tooth size discrepancy. It looks perfect in her frame, both retracted and in her smile. I did put on the lowers a fixed retainer. I do like removable retainers better because it's more hygienic, obviously, and less maintenance. But in a spacing case, I tried to get wires on, at least initially. On the uppers, there was no room for that. So she is also, in addition to the wire on the lower, wearing Monmouth removable retainers every night. If you look at her smile, by the way, and I'm going to point this out in the other as well, look how confident she looks when she's smiling. And if you go back a few slides, Chris, to her before, you're going to notice that her head's like a little crooked and just not comfortable. It's like, oh, get that camera away from me. And months later, like literally, she's just like, yeah, take a picture. Love it. Love it. And she referred to me another 5 patients. This is a third opinion patient. She didn't know me. She found me on Google. She already tried 2 other people she obviously thought of higher than me because she went there first, came to me and ended up referring us 5 more patients because she was blown away that there was an alternative that nobody knows about.